You're at risk, and the numbers are alarming. 1 in 5 cancer cases are diagnosed too late. Cancer is growing inside you right now, invisible but not for long. In fact, a study by the American Cancer Society found that in 2020, over 600,000 people in the US died from cancer, with many cases being diagnosed at an advanced stage. You're about to meet the game changer that could turn the tide. Think tiny, think powerful, meet the circulating tumor DNA. This tiny fragment of DNA is released by cancer cells into your bloodstream, and it's the key to early detection. For instance, a test developed by Grail, a biotech company, can detect lung cancer through a simple blood test with a high degree of accuracy, 89% in one clinical trial. What's more, researchers have discovered that some people's bodies can actually recognize and attack cancer cells on their own, a phenomenon known as spontaneous regression, which occurs in about 1 in 100,000 cases. As you learn more about circulating tumor DNA, you'll realize that the future of cancer diagnosis is rapidly changing, and it's changing fast. Your blood is a highway, with cells zooming by like vehicles on a busy road. But then, cancer cells come along, hijacking the system, and releasing biomarkers, which are like distress signals sent out to alert the body. Liquid biopsy is like a roadside checkpoint, where these signals are detected, and it's changing everything. You're the driver, and you need to know what's on the road, especially when it comes to your health. Take, for example, the case of pancreatic cancer, where liquid biopsy has been shown to detect biomarkers in 80% of patients, allowing for earlier intervention. Surprisingly, research has also found that the presence of certain biomarkers in the blood can even indicate the effectiveness of treatment, with one study showing that patients with lower biomarker levels after chemotherapy had a 50% higher survival rate. You see, liquid biopsy is giving us a unique glimpse into the world of cancer, and it's allowing us to tailor treatments to individual patients. As you navigate the complex landscape of healthcare, it's essential to understand the role of liquid biopsy and how it can help you take control of your journey. With this technology, you're no longer just a passenger, you're an active participant. Meet the epidermal growth factor receptor, a protein that plays a crucial role in cell growth. Cancer cells, in particular, have a strong affinity for it, overexpressing it to fuel their rapid growth. You might be wondering how we detect this protein. Liquid biopsy is the answer, a process that's like finding a needle in a haystack, except the needle is a protein, and it's called EGFR. You need to know its name because it's a key player in the fight against cancer. Take the case of non-small cell lung cancer, for instance, where EGFR is overexpressed in about 10% of cases. A study by the National Cancer Institute found that patients with EGFR-positive tumors who received targeted therapy had a 60% response rate. Surprisingly, EGFR is also involved in the development of neurodegenerative diseases like Alzheimer's. As you delve deeper into the world of EGFR, you'll discover its intricate mechanisms and the many ways it interacts with other proteins. The more you know about EGFR, the better equipped you'll be to understand the complex landscape of cancer research and treatment. With EGFR, the possibilities for targeted therapy are vast, and researchers are continually exploring new avenues. Here's the surprising part. Liquid biopsy can detect cancer DNA in your blood, even when you have no symptoms. It's like having a superpower. You can see the invisible. But it's not just about detection. For instance, a study by the National Cancer Institute found that liquid biopsy can detect cancer DNA in the blood of patients with stage I lung cancer with an accuracy rate of 97%. That's impressive. But what's even more surprising is that liquid biopsy can also detect cancer DNA in people who have never smoked, like the case of actress and non-smoker Shannon Doherty, who was diagnosed with breast cancer at the age of 35. You can't treat what you can't see, and that's where liquid biopsy comes in. It's like a pair of X-ray glasses that reveals the hidden enemy. And the best part? It's minimally invasive, requiring just a simple blood draw. This technology is revolutionizing the way we approach cancer treatment, allowing doctors to tailor therapies to individual patients. You're now part of a new era in cancer detection and treatment, one that's more precise and more effective than ever before. You're at risk of cancer right now, and it's a harsh reality. But liquid biopsy can change that, giving you a fighting chance. It's like having a cancer alarm system, constantly monitoring your health. You can detect cancer before it's too late, when treatment is most effective. For instance, a study by researchers at Johns Hopkins University found that liquid biopsy can detect lung cancer in 80% of patients, with a false positive rate of just 2%. And it's not just about you, it's about your loved ones too. You can protect them from the pain of losing someone to cancer. Liquid biopsy is like a guardian angel, watching over you and your family. Surprisingly, did you know that cancer cells can shed DNA into your bloodstream even when the tumor is just a few millimeters in size? That's how liquid biopsy can catch it so early. You can take control of your health and give yourself the best possible shot at beating cancer. With liquid biopsy, you're not just hoping for the best, you're taking proactive steps to protect yourself and those you care about. It's a powerful tool, and it's available to you right now. Most people think liquid biopsy is expensive, but that's just not true. It's like a blood test, something you've had before, a quick pinch and it's over. You've probably had a blood test to check your cholesterol levels or blood sugar, and this is similar. The cost of liquid biopsy can vary, but it's often comparable to other diagnostic tests, like an MRI or CT scan. For example, a study by the National Institutes of Health found that liquid biopsy can detect cancer biomarkers in the blood for around $500 to $1,000, which is significantly less than the cost of a traditional tissue biopsy. And it's not painful, or scary, for that matter. The real myth is that cancer is invincible, but liquid biopsy is changing that narrative. It's like a superhero cape, giving doctors a powerful tool to detect cancer early, when it's most treatable. Surprisingly, liquid biopsy can even detect cancer DNA in your blood years before symptoms appear, giving you a head start on treatment. Take the case of Grail, a company that's developed a liquid biopsy test that can detect over 50 types of cancer with high accuracy, using just a single blood sample. Here's the twist. Liquid biopsy can detect other diseases too, not just cancer. It's like a multi-tool, versatile and powerful. You can detect genetic disorders, like sickle cell anemia, and infectious diseases, such as tuberculosis. For instance, a study by the University of California, San Francisco, found that liquid biopsy can detect Lyme disease with 97% accuracy, which is remarkable. It's like having a health dashboard, where you can monitor your health in real time. You can track changes, identify potential issues, and take action before it's too late. Liquid biopsy is the future, and it's already showing promising results. Did you know that the global liquid biopsy market is expected to reach $12.7 billion by 2025? That's a significant investment in a technology that can revolutionize healthcare. You might be surprised to learn that liquid biopsy can even detect diseases before symptoms appear, giving you a head start on treatment. With its potential to detect a wide range of diseases, liquid biopsy is poised to change the way we approach healthcare. You can imagine the impact it could have on your life and the lives of those around you. It's an exciting time for medical innovation, and you're at the forefront of it. Remember this, liquid biopsy is the key to early cancer detection. It's a game changer. You have the power to detect diseases before they're too late. For instance, a study by the National Institutes of Health found that liquid biopsies can detect cancer DNA in the blood with high accuracy, with one test showing a 98% success rate in detecting lung cancer. But here's the thing, it's not just about cancer. It's about your overall health. You can use liquid biopsies to monitor chronic conditions like diabetes or heart disease. Surprisingly, did you know that some liquid biopsies can even detect the presence of certain bacteria in your gut, which can influence your mood and cognitive function? You have the power to take control of your health. Consider the story of Angelina Jolie, who underwent preventative surgery after a genetic test revealed she had a high risk of developing breast cancer. She's a great example of someone who took charge of her health. Now it's your turn. Are you ready to take the first step towards a healthier you? It's time to be proactive, to be in the driver's seat. Your health is worth it.